You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Curran Mohan.
Hello and welcome to another podcast of All the Pieces. I'm your host, Dr. Mohan, your Chief Quality Officer and hospitalist. Today, I have a very special guest with me, Chris Bowen, and today we'll be talking about something very specific that affects many patients and may affect sometimes your family members as well. It's called Stereotactic Radiosurgery. And to talk more about that, I have Chris here. And Chris, like everything else with my guests, I like to have them introduce themselves, so take it away.
All right. Well, thank you for having me, first of all. My name is Chris Bowen. I'm the Chief Medical Physicist in the Department of Radiation Oncology at Mosaic. And so for those of you who don't know what a physicist is, there was a certain point where I didn't know there was such a thing. I am in charge of all of the technical aspects of care in regards to radiation oncology. So we have these giant machines called linear accelerators that actually give the radiation. One of the things I'm responsible for is making sure that those are calibrated and commissioned properly, and then also the planning systems that we use that take all of our images, the CTs, the MRIs, and use those pieces of information and those imaging modalities to give the doctors dose information. I make sure that the planning systems are set up properly and that what they're saying yes to is actually going to happen in real life. And so I take care of that. And then also making sure that these plans are correct and deliverable. So it's a really interesting area of medicine, one that I didn't know existed until I found my way to this career. And I've been doing that here at Mosaic for surprisingly the last 20 years.
Oh my God. Did you start working here when you were 5?
There was a lot of Doogie Howser jokes when I first showed up in my 20s, and it's really amazing. Hopefully I'll get a chance today to talk a little bit about just how much our department has grown in my time here, because we went from what was a good place to get care when I showed up to absolute, in my opinion, state-of-the-art. And so it's been a really cool, interesting journey where we've continuously added really vital pieces to what we're able to offer our community. And so, hopefully we get a chance to talk a little bit
And
about
I believe
that.
that's well-deserved, and kudos to the entire Mosaic Cancer team to taking us on this evolutionary journey of providing state-of-the-art, and you're a big part of that, so thank you, Chris.
Yeah.
So what exactly is stereotactic radiosurgery, or SRS?
Okay, so SRS, and to the people listening, don't feel bad. There's no reason why you would need to know what this is if you haven't been affected by it, or somebody you know or care about hasn't had to deal with this. But SRS, or stereotactic radiosurgery, is a term we use in radiation oncology to define a really high-level, complex treatment technique where instead of a conventional therapy where you might come in and see us multiple times, it really does work like an actual surgery. So if you have a target or a lesion in the brain, SRS is focused primarily on what we call cranial treatments, or in the head. You would get a single treatment of very high dose that has the exact same effect as going in and doing an actual procedure. And so what we see a lot of times, if you have an area in your brain that needs to be treated, we can see that it needs to be treated, but for our neurosurgeons and our teams in that area, you don't always have somebody who we consider a surgical candidate. Maybe it's just in a place you just can't go physically. Mm-hmm. And so we're able to bypass all of that and perform that same surgery using radiation, and it will have the same effect. And so instead of going and doing a scalpel in an OR, you're coming to see us, and post-treatment, what we treat kind of melts away and disappears, the same as if we had gone in physically to get it.
Is it invasive?
No, there's no invasiveness to this whatsoever. The patient, kind of to talk about the process, and we can cover this again, in a few minutes if you'd like to go through the whole process. But they would get their MRI, They would get their CT, and I'll lay these things out in detail so that everybody knows what it is that we do that's a little different. And we combine those image modalities and fuse them together so the doctor can get a really good look at what they want to treat. And once that is delineated or drawn in, we're able to design a plan that can put a patient on the table and treat them. And there's no, you're not getting knocked out, you're not being put under. They're
awake the whole time.
Yes, absolutely. Yeah, all that we end up asking is that you stay very still, and we have
you can't sneeze.
Yeah, right, and we have some really good specialized parts of our treatment process that make sure you actually can't move, and then we deliver the surgery over the course of about 15 to 20 minutes, and you've just had brain surgery in that time. So instead of this, and don't get me wrong, it's still probably a very stressful, anxiety-filled experience for a lot of people. You think of the prospect of having brain surgery, how scary does that sound? But like I'll say probably again, in the end, one of the best responses we get most often from our patients is we do something incredibly complex, and this treatment's super precise, and all this careful planning, and they go through all this, and their most common reaction is, that was it? And so, what a compliment though, right? That after everything we've invested in our Stereotactic program and in radiation oncology, to be able to offer our community something that state of the art, most people are completely unimpressed by it. And I don't know, maybe they were expecting a light show or something crazy. You say, okay, I'm going to go have brain surgery tomorrow. And what they end up doing is coming in and getting some of the best care you can possibly get on the planet, and then you go eat lunch with your family afterwards. There is no,
that's amazing.
We'll see you in a week when you recover and you check out of the hospital. You're going out to lunch, unimpressed with everything. And so, it's kind of a fun reaction that we have as a staff every single time a patient says that. We kind of smile because we know how much went into making that quote unquote unimpressive for them, and they just got something that is so precise and so accurate that it can't be achieved by any other means, and they have no idea.
It's a bit anticlimactic, right? Like seeing the Statue of Liberty, saying, "Oh, I thought it'd be bigger in real life."
Right. Yeah, I thought brain surgery was supposed to be a big deal.
Right.
But that's part of our job, right? Is to make it not feel quite so scary, and that they can go along for the ride for us and ask questions and understand every part of the process.
That's amazing. So you said you can do this in a relatively short amount of time, but how small of a target can you go?
It's a great question. And there are, and depending on the answer to the size of the lesion that we're treating, we'll do a couple of different things. So for larger lesions, and
what do you define as large and what do you define as small?
That's another good question. So we deal with everything to do with stereotactic radiosurgery, and I'll just start saying SRS. I think it's easier. Yeah. We're dealing with things that are submillimetric, and so we want to be precise to the point of fractions of a millimeter, because every opportunity we have to be precise is extra healthy brain that we don't have to treat. And so our physicians deal with really small margins. They might find a lesion that's 8 millimeters or 7 millimeters or 6 millimeters, and they only want to put an extra millimeter out around that to make sure that everything in a little bubble, if you can kind of picture that, around that target that we want to treat, gets 100% of the dose, and then we want that dose to fall off really quickly. So we're only treating exactly the spot that needs to get treated, and we're sparing all that extra healthy brain. So if you came and got treated 20 years ago, even though there were still traditional ways of doing SRS, there were a lot of people who would get what we call a whole brain treatment. And we say, okay, Mr. and Mrs. So-and-so, you have 15 different targets, and we can't get them all. It's time prohibitive, and I'll talk a little bit about what we do versus a traditional SRS. But when it got to that point, you would say, we're gonna treat your whole brain, and we're gonna get everything under control, But after that, can't give you any more because your brain's already gotten
too much radiation.
This much dose, and so that's kind of it. What this technology has freed us up to do is we can treat those 15, or we can treat those 3 or 4, and then if anything else happens down the road, come back and we'll treat those as well, because we spared all of your healthy tissue. So we can keep continually treating you, so that instead of a couple of months down the road having there be nothing more, we see patients 2 years, 3 years, 4 years, from when we first treated them, and that's really rewarding. But back to your original question, most of the time we get a fair amount that are under a centimeter. When they are 2 centimeters or larger, instead of doing 1 treatment, we might change that to 3 treatments. And so those are kind of the flavors that we...
Just to nibble away at the larger...
Right, and that's all on the physician end of things with recommended guidelines and stuff. So it's still considered a stereotactic radiotherapy. It's just that for larger lesions, we might split it up into 3 fractions, where your smaller ones will treat just once.
So I'm going to ask 2 potentially dumb questions. One is, does anybody actually sit there with like a big gun and a target sign and start zapping away, or does the machine auto?
Okay,
is it all like auto mapped out?
No, it's great. So like
is there a technician element to it that if you're having a bad day or you start coughing or sneezing during the procedure, will that impact the outcome, or once you click a button and it's just the machine does it all?
Great questions. Okay, so to take a step backwards, since people might not be familiar with what it is that's delivering the treatment, we use what's called a linear accelerator. And so if you haven't been part of radiation oncology and you haven't had a friend or a loved one or had any personal experience with it, Mosaic has 2 state-of-the-art true beam linear accelerators. And so that is the best piece of equipment you can have by far, that's available anywhere to treat photon-based treatments. And so the lasers you're talking about, it kind of does work like that.
Lasers.
Yeah, right. Yeah. It does. It does sound a little science fiction-y, and in a really cool way, it kind of is. Picture a giant machine that takes up most of the room, and it's several tons. I mean, they're really enormous, but all of that is so precise, it can rotate around you and be accurate to fractions of a millimeter where it's rotating. And so along with the ability to do that and give that radiation, it's also equipped with 2 different types of imaging. So it's actually its own CT, which we utilize. And then there's also another panel that can come out and take a quick snapshot mid-treatment too. So to go back to what you were talking about, what happens if the patient were to cough, because you want to be very still.
Sure.
We have the ability to just take a second. Oh, the patient moved their foot, or they coughed, or they need to be let out of their mask, and we can reshoot an image, confirm that they're still exactly where they need to be, or if we need to move them 0.2 millimeters here, or a half a centimeter there, we can do that and continue. But the processes we put in place and the equipment that we use, you usually can cough, and as long as you're not trying to wrestle out of your setup, you're held perfectly still. And what we found is our patients stay exactly where they need to be every time. So
excellent.
Yeah.
And the second question was, what exactly are you shooting in the brain?
So when we talk about SRS and SRS patients, what normally happens to somebody is it doesn't usually start out that the first thing that happens to them is that they have lesions in their brain. Normally, what we're treating is called a metastasis, which means
spread.
Yeah, it started maybe very often for us. It starts in the lung, or maybe a breast cancer, or even colorectal. Primarily lung. We see the majority, but you've been treated for that, or you've had a cancer in the lung, and when that spreads, very often, sometimes that can create spots in the brain that it goes to. And so these targets that we're referring to, they'll show up very, very well on MRI, which is one of the modalities that we use. In fact, it's the primary modality that we use to have the doctor say, okay, that's the spot we want to treat. It shows up okay on CT sometimes, but really it's that marriage of using your MRI and the CT and putting them together, and we're able to identify those spots and say we need to treat here, here, and here, and this one's kind of close to the brainstem, this one's a little close to the eye, and that's where we begin formulating our treatment plan. And so we can see all of these things on our planning system using all of these different imaging techniques, and then go day of, and since we have a CT on this giant machine that's actually giving the treatment, we're able to take another whole 3D image of the patient and say, okay, when Bob was here before, when we imaged him, his head was just so and tilted. And the other thing that's really nice about the equipment that we have is your table doesn't just go up or down or left and right. You can actually tilt it and roll it. And so if you have just the slightest tilt to your chin, we can account for that. If your head is tilted to the side when we made the mask that secures you in, and the table needs to roll slightly at an angle, it can do that. It basically finds exactly where you need to be an exact match to how we planned it, so that you have no choice but to get a perfect treatment.
That's amazing. And
Yeah.
the technology really drives a lot of this benefits, and it just shows the commitment of Mosaic to going the extra mile for the patient.
It does.
More so, it sounds very science fiction, and you being a physicist,
Right.
I absolutely appreciate your passion for it. Just to backtrack, you said you've been doing this for 20
I have
some
20
odd
years. Yes.
What changes have you seen? I mean, you mentioned whole brain radiation, and now this sounds pretty targeted. What changes you have seen, and how do you think that has impacted our patients in the community?
So we have gone from a traditional treatment, and I'm dating myself here because anybody who's dealt with this knows how far back you would have to go to have this be the case. But we started off, when I first started off, you kind of, we did what's called forward planning, and you're looking at what you can see on the images, and you kind of design a treatment where you have multiple angles you're coming in, and you're going to treat what you can see, and you're going to try and block out the healthy stuff, and that's kind of it. And we call that conformal. You're treating what you can see. That quickly evolved into what we call IMRT, where you're kind of changing gears. IMRT stands for inverse, an inverse mode of planning, where you're kind of giving the planning system a recipe, saying, okay, we're gonna treat this prostate, and we don't want to treat bladder, and we don't want to treat this other thing, and we want to watch out for the kidneys. And the computer goes, oh, okay, I get it. And you give it a kind of a recipe and say, okay, this is more important than that, so make sure you pay attention to this. And it can take all of that into consideration and design something that is too complex for you or I to design on a computer. And so that is kind of the shift that we've seen. And then we keep adding more complexity to that. We went from that to saying, okay, don't just do that. Let's up the dose and lower the number of times somebody comes in. So instead of coming in 40 times, let's do it just 5 times at a higher dose. And so you're upping those stakes. And so if you're going to make it more complex in that way, we needed also to evolve with how we run quality assurance for that, and how do we make sure these things are perfect. And so we've gone from forward planning to the computer coming up with these incredibly complex plans, where instead of just 4 different angles where we're shooting, you're going to see the machine sweep around you the entire time, and the opening in the machine where the dose comes from is doing all of these intricate movements with what we call leaves in the head of the machine, and it's shaping the dose that comes out in a way that we have no ability to check. We have to rely on secondary pieces of equipment, which is another area that I'd love to talk a little bit about today.
Sure.
to just underscore how different care is here from other places. And
Yeah.
so
Please go on.
so to do something like that, fast forward now where we have these only few treatments, very high dose, there's, as you can imagine, there's no margin for error. You don't
Right.
get to have a do-over. So what do we do at Mosaic to make sure these treatments are perfect, or as close to perfect as we can? And the answer is we do a couple of things. We have very highly specialized quality assurance devices that can tell you if there is a 0.3 millimeter difference in the way something's happening versus, in between machines or in between plans. When you have equipment that's that sensitive, we set really strict standards. And so the way that kind of plays out is we say, okay, this person's brain treatment is next week. Let's go ahead and take this plan and see what it would look like if we delivered it to this device instead of delivering it to the patient. And we set really strict standards, like this has to be perfect, or I don't want it to show something passing. And so we deliver what's going to happen to the patient ahead of time, which is a really great way to make sure that everything's going to be perfect. And so we have a device that goes for the entire ride that the patient is going to go for. So if there's any imperfections or anything like that, they're going to show up ahead of time. And then the second thing we do, which I believe, physics, we kind of have a close-knit community. There's not too many of us, so we all kind of know what the other people are up to. Another really cool, I think it's cool. I apologize to the people listening if you don't think it's cool.
Yeah, they might think it's cool too.
We have a special device called a multi-med Winston Lutz Phantom, and that means nothing.
Say that 4 times.
Yeah, right, yeah. It's nothing anybody would ever want to mess with who's not in my field, but the purpose that it serves is really remarkable to the point where I don't think that you should, my personal feeling is you shouldn't get care anywhere where they don't have this if you're going to get a treatment like the ones we're able to give you at Mosaic. And what this device does, remember I was talking about that big machine moving around a single point. Well, the best way to describe this is, let's say we're going to treat 4 spots in your brain tomorrow. Okay, so let's say they're here, 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 and here. We're going to treat them all at the same time, which is what's unique about what Mosaic has, and I'll talk about that in just a second. But to make this point, what if we're not treating in the middle, that point that I told you that it rotates around? All of your spots that we need to treat, none of them are there. So most other places are checking to make sure that the machine is behaving itself right here, but they're not checking to see if it's perfect on these other spots. This device, instead of just proving that the machine is perfect right in the middle, kind of makes a ball. And anything inside of that ball, that sphere of about 7 cm, we can guarantee is accurate to submillimetric values. So I'm not just worried about one point. I can tell you everywhere we're going to treat your spots tomorrow, I've already proven that the machine can do it perfectly under a millimeter, and I already delivered what's going to happen to you to another device that also told me it was perfect. And when you sit on that couch and we lock you in and get you in that just right position that we talked about from imaging, it takes all the stress out of what could otherwise be a really, really stressful situation, because myself and my team and our doctors, we already know your treatment is perfect. All you have to do is lay back and relax and get your brain surgery, because all the hard work is already done.
That's amazing.
Yeah.
That is amazing. And I love geeking out with you about this, because I never liked physics as a kid or even as a college kid.
Shocker, everybody loves physics. Come on.
But the way its practical application to direct patient care is what resonates with me on so many levels.
Yeah.
You're looking at it from a technical aspect, but the mission is the same, which is the patients don't know any of this stuff.
Right.
Or care to know about any of this stuff.
Right.
But how important it is for us to deliver on the promise of quality care and making sure that their process, their experience, which is a life-altering diagnosis in many ways, is so seamless that it doesn't even get felt on that level of, So, and for that, I think, Chris, Mosaic is truly blessed to have you as part of the team. Anything else you would want our patients to know about SRS, or anything that they should know if they're not even being treated at Mosaic?
Sure.
Or if they go to some other institution, what should they be looking out for?
Yeah, I'm really happy that you asked that. The things I want to mention before our time's over today is the particular type of SRS that we do at Mosaic uses a technology called HyperArc. And so what's important about that is
all sounds very Star Trek-y.
Right. It does, right? Yeah, warp drives and yeah, it's kind of funny. And it's a great story that I'll touch on in closing in a minute too. But hyperarch is different than conventional SRS in that if you went anywhere else right now, and I mean this literally, and I can't say it enough, and I've spoken on Mosaic's Stereotactic program a number of other times, but I'll never get tired of mentioning it because it really, there's every opportunity to get out there is good for our community to know. Mosaic is the only facility that has hyperarch right now still, and we are nearly 200 cases in, and we've done this for almost a half a decade, and there is nobody in the Kansas City area. I think you have to travel a good 400 or 500 miles maybe to find the next facility that has what we have. And we were actually one of the first 50 institutions, I think, nationwide, maybe even globally, that had this. The difference is instead of having to reset up a patient one by one, back to your 4 lesions that we're going to treat, or 3 or whatever your fictional lesions were. Right. If you're getting treated anywhere else, we go one by one, and each time we treat a target, we're resetting you up, we're redelivering. That turns into 2 hours, 3 hours, 4 hours. Now pretend that you don't do well laying on hard surfaces. You're already nervous about this. Can you imagine laying on the table for 2 to 4 hours, right, anxious as we reset you up and treat, and reset you up and treat? Maybe even we take a break and we do, your last one tomorrow because you just can't sit on the table anymore. At Mosaic, it doesn't matter if you have 1 spot that we're treating today or 10. Same 20 minutes, and all of it's perfect, and there is no resetting up, and we're thrilled that you're completely unimpressed when you get off the table for doing it, and you will never know. And I think that's great, but sometimes I also wish that our patients and the people we care for had that gift of contrast, had somebody else that they knew had experienced it, because the person who got the other type of care, they probably wouldn't believe, what do you mean you had 4 and you got treated in 15 minutes? That's impossible. It really is kind of science fiction-y, because right, only we have that capability right now at the level that it's at. And so that's one of the great things that Mosaic has done. And to speak to that, this is a good story. We almost didn't have it. We knew we wanted to be able to offer our community stereotactic capabilities and to be able to treat brains. We were literally going to finalize the deal to have what everybody else has. And I made one last call to the vendor, and I said, I know you guys have been working on this state-of-the-art
hyperarch.
Hyperarch. It's too bad that you guys didn't have it ready. We really would have liked to go in that direction. And the guy said, well, that's really funny you said that. And I said, what do you mean? And he said, well, we just got approved. It's going to be released, in a month. I said, are you serious? Wow. And he said, yeah, no, really, why? And I said, they're going to sign the deal to go the other route and kind of catch up to what everybody else is doing. I said, I got to let you go. I got to run down the hall. And this is all true. I ran down the hall. I said, it was like the end of Goonies, where they say, don't sign the paperwork, don't sell. And so we stopped everything. And one of the things that I continue to be appreciative of, and this has always been the mentality of the administration and this organization, they never asked me, how much does this cost? How much trouble is it going to be? They only ever asked one question: what's the best? What is the best thing that we can have to treat? What is, if you could, make a wish, what should we be going for? And to have that be the spirit of, the guiding hands and the direction that we're going to take as a healthcare provider for this community, what a great attitude.
Right.
That's all I've ever been asked as a physicist, as the person who gets to bring these very complex toys in and get all of this really high-tech stuff. The only thing I've ever been asked is, what is best? And so the answer has always been yes. And so to tie back into your question, what other things would I like people to know if they're not getting care here? The questions I would tell them to ask are, how are your MRI processes being conducted? At Mosaic, we made a special investment, tens of thousands of dollars, as a matter of fact, to be able to put you into the same mask in MRI that we're going to put you in for CT. There are a lot of other facilities. In fact, I don't know of any that have made our investment. They say, just go get your MRI and then we'll let the software do the fusion. And while that's fine, remember, you and I were talking about some of these lesions. They can be pretty small. A head tilt here, you're asking for software to make those corrections. If you get treated here, we've gone the extra mile, and your head is in the exact same tilt, position, roll, whatever you want to call it. You're locked into the same immobilization for MRI that you are on CT, that you are for treatment. What that means, in simple terms, is you got set up the exact same way every time. When we lay that MRI onto the CT so we can draw your lesions, it's not close to perfect. We're not asking a computer to kind of distort the images. It's already perfect. And a step further than that, we are continuing to invest. A question I would have somebody who's getting care ask also would be something like, how do you make sure your MRI is what it needs to be? If you're telling me that you're using this to find out what needs to be treated, how do you know that that's perfect? I mean, there's a million things that can probably go through your head when you're getting treated. We just finished purchasing a device that will actually grade our MRI for very, very small levels of distortion, because every millimeter matters, every half a millimeter matters, and we don't want to be good, we want to be perfect. And so every single part of our process, we've committed something to ensure that is as perfected as it can possibly be, so that from the time you come to see us and get imaged, to your MRI, to your treatment, the entire process has so many extra things built into it if you get care here that aren't available anywhere else. I really can't speak, and I know it probably sounds like hometown bias, of course.
No,
no one's going to tell you, don't go here,
right.
Go somewhere else. But really, truly, nobody else is doing what we're doing here. To know that you'd have to travel, to a different state, to a different city to even come close, it really speaks to the level of commitment that Mosaic has to quality care, and it makes it really easy to be enthusiastic the way that I am.
I love it.
Yeah,
I absolutely love it.
So, yeah.
So I see the passion, I see the commitment, and I thank you for that, Chris. I know you have a great team around you, and I'm proud to say, as an organization, we support good quality outcomes for our patients, and also to support nerds like you.
Right, happy to be one. It is a great place to be into high technology, because the organization really does have a strong commitment to making sure that now that we're on the cutting edge, that we keep that lead. Yeah. And that's another really encouraging thing. We haven't found that we kind of just say, all right, we got here, let's milk this and just kind of rest. We have continued to add pieces every single year that make the next year even better than before. And so we'll have some really exciting things. Hopefully I can be back soon to tell you about a whole nother host of things that nobody else has. And what makes that possible is the commitment we've already made. You can't go to the next thing if you're not even caught up. And so to not only be caught up, but to be a leader, what a great gift to have for our community.
Absolutely, and our patients are better for it. Well, there you have it, folks. We heard from Chris Bowen, our chief medical physicist, and the amazing work we're doing in stereotactic radiosurgery, or SRS, targeting very small lesions in the brain and making sure that the patients are in and out before their coffee even gets cold. So for that, Mosaic is tremendously thankful, and we're honored to pass that gift to our patients. If you have any more questions about it, please reach out to myself or the radiation oncology treatment team. But if you're ever encountered a situation where brain lesions are to be targeted, I can't think of any other place that to get treated than Mosaic. And for that, I'd like to thank our guests for listening, and thank you, Chris, as well, for coming and participating and showing the amazing passion you have. And until next time, folks, take care, brush your hair.